Hi, Kevin Henry, the Group Editorial Director for UBM Medica's Dental Division, and I'm on a Google Hangout today with Jan Palmer. How are you today, Jan?
Good, thanks, Kevin. How are you today?
All good. Thank you so much for taking a few minutes to join me today, and I'd love for you, if you have just a moment, to please introduce yourself to our viewers.
I certainly will. Thank you for having me today, Kevin. My name is Jan Palmer. I have been in the world of dental sleep medicine since 1999. I started working with a dentist that was just getting into this. And as she was learning, I was learning too. And it was a little frightening at the beginning. I would almost try to talk patients out of having to come into the office because I didn't know what I was doing. Therefore, over the years, I've developed a course, and I've also spoken at many conventions and in office trainings over the years to share my knowledge.
And part of that knowledge that you're going to share today is on kind of how to start that conversation with patients about obstructive sleep apnea. So let's look at it from the dental side first. If I'm a dentist and I want to start treating sleep apnea in my practice, how do I go about getting patients to know that I can do that and get them in the doors?
Well, you have to start by, what I would suggest, to start by looking at your current patients, the base, and look at their health histories. Because a lot of things that go with sleep apnea will show up in their health histories. If the patient has a history of stroke, if they have a history of mood disorder, hypertension, cardiac arrhythmias, these could all be linked to sleep apnea. That is where I would start and open the dialogue with the patient. And a lot of patients have been diagnosed and they have CPAP machines that are sitting in their closet because they hate it. And this is a good way for you to get your foot in the door, so to say.
So what are some questions that should be asked to kind of get that conversation going?
Okay, well, there's a couple different things you can do. There's some more formal questionnaires you can do. There's one, if you Google it, it's called the Epworth Sleepiness Scale, and basically it asks the patients a series of questions, and they give it a rating between 1 and 4, and it's based on a score of 24, and you add up the answers at the end, and if it's over 10 to 12, it means that they could have a problem, one of the many sleep diseases, and it would open your dialogue. There's also another one that works really well, and it's called the stop-bang theory. And this was started by anesthesiologists because when they're going to put a patient under anesthesia, they want to know if this patient's going to stop breathing, and they're going to keep them intubated a lot longer. So it's basically a series of questions. The stop part is for snore. Do you snore? And then, do you often feel tired for the T? And has anybody observed you during your sleep to either stop breathing or gasp for air? And then the P is, do you have high blood pressure? So that's the first part. If they say yes to any of these, your radar is going to go up. And then the bang part of it is the body mass index. Is it over 35? Are you over 50? As you age, gravity takes effect and things start collapsing, and so does our airway sometimes. Neck size, you want to know about that. If it's more than 16 inches for men or more than 14 for women, it's going to have an effect because that's just more pressure on your neck when you're sleeping and your airway can collapse. And then your gender, for the G, is if you're a male, you're more prevalent to be having the condition of sleep apnea. The hygienist can start asking questions, and so can the assistant. There's a lot of questions you can ask.
And that was one thing I was going to ask is, obviously the team probably preps everything to get the doctor ready for the conversation. Is that how you've seen it happen in most practices?
Absolutely, yes. And you're the first line of defense, the assistants and the hygienists, and there's so many questions you can ask. Generally, just a basic question like, does you or anyone in your family snore? Statistics show that a lot of people that snore do have sleep apnea. Everybody knows somebody that snores. Do you have a child that has ADHD? They treat the children with drugs, and a lot of times it's sleep apnea that is actually the underlying cause of it. So there's a lot of different questions that you can ask the patients while they're in the chair.
And let's say that the assistant or the hygienist is asking these questions and they go, the red lights start going off. So what's the next step for them to kind of prep the doctor for that conversation?
Well, I think that what they would say at that point is that they understand that sleep can take a toll on the general quality of life as well as health problems, and that you're going to bring it to the attention of the doctor, and the doctor can discuss it further with you to see if you might be at risk for this disease.
And one thing that I've heard in so many practices, the doctor may talk about something and then he or she may leave the room and the patient will turn to the assistant and say, what do you think? So I know it's vitally important for the team and the dentist to all be on the same page about this, correct?
Absolutely. That's why you have to educate the staff just as well as you educate the doctor. They have to know the basics. They have to know why you're treating this. They have to know the comorbidities that go along with a decreased quality of life too.
Sounds great. Jan, thank you so much for your time. If our viewers have any questions where they want to reach out to you to get some more information, where can they find you?
Absolutely. They can shoot me an email, and just if you would put the Google chat in the subject box so that I know where you came through, so that I know how you were able to contact me. My email is jan@dentmedins.com. That's Jan at, and then it's dent as in dental, med as in medical, ins, short for insurance.com.
Sounds great. Jan, thank you so much for your time. And let me just remind our viewers that this is the second in a two-part series that Jan and I have done. So we'll have a link in here that you can make sure to find that first one as well so that you can get caught up on the whole series. So Jan, thanks so much for your time. Really appreciate it and your expertise.
Thanks for having me, Kevin.